Tá, já vamos lá. Agora eu vou de novo. Ok. Good morning. Welcome to the first webinar of the ISfTeH in 2018. For today's session, the TeleNursing Working Group, coordinated by Dr. Konstantinos Antipas, Dr. Claudia Bartz, and Dr. Pirko Kuri, will count on 2 presentations. So, right now, we are very pleased to introduce you to Dr. Clarissa Rodrigues from Brazil. She will speak about Global Research and Innovation Network. Dr. Clarissa is from GREEN, Global Research Innovation Network Company. And after that, we'll have the second presentation by Professor Patrícia Dias, also from Brazil. Patrícia is a nurse from AGM Telehealth Company, Brazil, and also an ISfTeH member. So, we are starting this year officially through our web conferencing program. And since now, I'm very pleased now to open the presentation of Dr. Clarissa Rodrigues. Welcome, Dr. Clarissa. Good morning.
Good morning. Thank you, Dr. Rodolfo, for the introduction. It's my pleasure to be here today to talk about intervention research in nursing, where we are now and why we need it. So I would like to start showing you the pyramid of evidence in healthcare. So this is the evidence pyramid where you can see the different types of study design. So until not so long ago, it looked like the image on the left side with systematic reviews and meta-analysis on the top of the pyramid, which means it was considered the type of study providing the highest level of evidence. However, as we know, systematic reviews and meta-analysis summarize data from other types of studies. So this pyramid recently changed. And systematic reviews and meta-analysis are not anymore on the top of the pyramid, but they are now considered a type of study to look into other types of studies. So look into other published studies, which actually makes much more sense. So now we have randomized clinical trials back on the top of the pyramid, which are a type of intervention study, which is the topic of our presentation today. So this is the type of study which is considered nowadays the type of study providing the highest level of evidence in healthcare. But how can we define intervention research? It's, just one second. Okay, it's a type of study design specifically to assess the efficacy of a particular intervention or to compare different interventions in healthcare. It represents a scientific approach to the development of innovation and evidence-based health intervention. That's why we need this type of study, not only nursing, but in all areas of healthcare. Here we have a classical design of randomized experiments. We can have much more complex examples of it, but if we understand this example, we can understand the other ones as well. So basically we have 2 groups. We can actually have more, but here in this example we have 2 groups, the intervention group and the control group. And the key word here is the randomization, which means that the patients are assigned randomly to the intervention group or to the control group. So if the patient is in the intervention group, they will go through intervention, and if they are not, of course, they will not go through intervention. And the variables of interest, they are measured before the intervention and after the intervention. So as we can see, the difference between the 2 groups is only the intervention. And as the patients are randomly assigned to the groups, we can isolate the effect of this intervention. Here in this picture, we can see the number of publications, the clinical trials publications in nursing over the years. And we can see it's been increasing over the past 30 years. And here we can see the spread of these publications in the globe. As we can see, most of the publications are still coming from the United States and Europe, but we do have some publications from other continents and countries. And in numbers, the United States is still on the top, which represents about 30% of all clinical trials in nursing in the globe. So almost 30% are coming from the United States. And as we said before, we need intervention research to generate evidence, to generate innovation. So one of the ways to measure innovation, it's not the only way, but it's a good way to measure innovation, is the number of patents filed. So as we saw before, we saw an increasing in the number of publications over the past 30 years. And we also can see this increase in the number of patents filed in the nursing area. When we talk about numbers, globally, almost 15,000 patents were filed in nursing, and most of it are also from the United States. So the same thing that we can see in the publications, we can also see in terms of innovation. Now I'd like to bring you some examples of clinical trials in the telenursing area. So this first one is measuring the impact of telenursing on adherence to treatment plan in discharged patients after coronary artery bypass graft surgery. It was designed as a quasi-experimental study, which means it's almost the same of a clinical trial, experimental study. However, it's missing the randomization part of it. So you still have the two groups, but the patients are not assigned randomly to a group or another. So in this study specifically, we have an intervention group with 36 patients and a control group with 35 patients. And the intervention, which was the telenursing program, happened on the first week on days 2nd, 4th, and 7th, on the second week on day 11th, on the third week on day 18th, and on the fourth week on day 25th after discharge. Here we can see the results. So on your left side, you can see the adherence to treatment plan. So the different types of adherence that were considered in this study. So you can see adherence to medication plan, to care plan, to diet, to exercise, and also an overall adherence. And we have here three sets of statistics and p-values. So the first set is about the before and after intervention in the telenursing group. The second set of statistics is the same of the first one, but in the control group. And the last set of p-values and statistics is comparing telenursing and the control group, so intervention versus control. So what we can see here is that in both groups, adherence was improved, but it was still more in the telenursing group. Another example is this study, which is entitled The Effect of Sustained Nursing Consulting via Telephone, telenursing, on the Quality of Life of Hypertensive Patients. So it was designed as a blinded, randomized controlled trial. The intervention group consisted of 32 patients and the control group in 33 patients. The intervention was during 8 weeks, and quality of life was measured using the ISfTeH questionnaire. And quality of life was measured at baseline, which they called the first step, after the 8 weeks intervention period, which they call the second step, and also 1 month after the end of the second step, without any intervention in both groups. So they are not only measuring the intervention, the effect of this intervention, they are not only measuring quality of life right at the end of the intervention, but also a month after the end of the intervention to see how the effect of this intervention is sustained over this period of time. Here we have the results. This is about only after the 8 weeks intervention. So we have here on the left side the quality of life dimensions. So we have a total score and also a mental health, general health, physical functional, bodily pain, role physical, social functioning, role emotional, and vitality. And you can see this table, which is comparing intervention and control group, that in all dimensions considered, the quality of life was improved in the intervention group. When we look about the sustained intervention, which means how the quality of life is a month after the end of the intervention, we also can see the same benefit. So we can say that the effect is sustained over time. We talked here about 2 examples, but we have much more than this. If you look at PubMed, so here I'm just bringing 2 more examples, just to show you how many studies we have in the telenursing area. However, we don't only need clinical trials in the nursing area, but we need high-quality clinical trials. So this study was published about 7 years ago, and it is a systematic review of blinding in nursing clinical trials. Blinding is one of the criteria to measure quality in clinical studies. So this specific systematic review included 16 journals in the nursing field, and almost 200 clinical trials. When we look at the results, we can see they considered 2 different parameters. So the first one is blinding of at least one group, because actually you can blind many different groups in your study. And here you can see the blind of each of these groups. So blinding of study participants, blind of intervention agents, blinding of data collectors, data analysts, and also healthcare staff caring for participants. So when we are talking about blinding of at least one of the groups, from the 199 studies included, only 32.7 studies used a blinding of at least one group. And the same results you can see when you look into each of the groups considered. And one more important thing that this study brought us was that, as we saw before, 32.7% of the studies used blinding of at least of one group. However, 49.2% of the studies said they use blinding. So we have here 2 different problems. Most of the studies, they don't use blinding of any of the groups. However, some of them say they use blinding, but they don't actually use it. Another interesting study here is this one, which is entitled Clinical Nurses' Attitudes Toward Research Management and Organizational Resource in a University Hospital. And the aim of this study was to determine clinical nurses' interest and motivation for research. An additional aim was to identify management and organizational resources in order to improve nurses' research capacity in practice. It was designed as a descriptive cross-sectional survey, which included 364 clinical nurses from a university hospital on the west coast of Norway. So here we can see some of the important research barriers that were identified in this study. So lack of designed time to do research, interest and knowledge, lack of research supervision and support, And actually, research supervision was one of the most significant needs to enhance clinical nurses' research skills, management, and organizational of research activities. Here in figure 1, we can see the ways in which research departments could assist nurses to enhance research skills. So the most cited was research supervision, as we said before, followed by grant proposal preparation. So they say they need it to improve their research skills. Here in figure 2, you can see the areas of research skills nurses would like to improve. The most cited one was defining or refining research questions. Also, help on research design, building community partnerships as a basis for research, conducting literature searches, which is a very specific task inside clinical research, and also evaluation of implemented research results. And here in figure 3, we can see strategies for skill development, where the most cited ones were individualized assistance, and also a series of small group workshops on research design, implementation, analysis, and publications. This is another study which is entitled Clinical Nurses Research Capacity Building in Practice. It was also a systematic review and included 8 studies. From this study, 3 themes emerged from analysis, which were the first one, failure to ensure quality of standards. Number 2, developing a research culture. And number 3, collaboration and organization of research utilization. So based on these results, we can say that we can talk about the challenges and perspectives. So we do need methodological improvement of our clinical trials. So as we saw before, we do have some clinical trials in our area, but most of them are still high quality studies. So we need clinical trials, but not only clinical trials, we need high quality clinical trials. So we need methodological improvement of our clinical studies. We need investments in research culture. We need increased institutional support to train nurses and provide adequate environments to stimulate clinical studies. We need increased collaborations to allow this study to happen, and also increased private and public funding. Thank you very much, and I'm available if you have any questions.
Thank you very much, Dr. Clarissa, for this very interesting presentation about intervention research in nursing, bringing important information about clinical trials in nursing, evidence-based studies about health intervention in nursing and through telenursing, and also talking about the major barriers about the implementation of this kind of studies and also training activities for research for the nurse. So thank you very much. I think this is really very important, and in fact, this is something to be a topic very important for the International Society for Telemedicine, not limited to the telenursing working group, but also for all members of the ISfTeH. So thank you very much. I'm right now very pleased to invite Professor Patricia Dias, also from Brazil, to speak about assistance strategies to support institutionalized elderly. So I hope Professor Patricia can hear us, and I'm very pleased to ask you to start your presentation. Good morning.
Good morning. I'm delighted with the opportunity to present our experience with strategies to support institutionalize the elderly in this important session.
Thank you very much.
So,
We can hear you perfectly. Please continue. Thank you.
so the idea of developing projects in this area arose from the observation of the current reality where aging is considered a worldwide trend, being an important characteristic of the 21st century. So, at the same time that cities grow, it's progressively perceived an increased number of the people aged 60 years or more. In this case, uh, because of the typical fragility of the aging process, there will be a higher incidence of chronic disease in the population. There is a predisposition to the development of pressure ulcers, which demand high costs and knowledge for their appropriate treatment. In this case, one of the ways to equip professionals is through telehealth. In this context, the dignity of geriatric telehealth project was created. It was implemented in the Asylum of Beggars of Pelotas, which is a charity nursing home located in the southern Brazil. The implementation of this strategy was developed through a partnership between ADM Health Company and the Telehealth Center located at the Institute of Cardiology of Rio Grande do Sul, Brazil. The financial contribution was provided by John Deere, a Brazilian private company. The objectives of the project are to restructure the physical area, to offer tele-CD diagnostics, to provide a teledermatology strategy for identification and treatment of skin lesions, and to train nurses for using the new strategies. During a visit to the nursing home, we observed that it was necessary to improve the accessibility of the bathrooms and to improve the quality of the bath because during the winter the showers didn't warm enough. The renovation included installation of air conditioners, solar heating for the showers, non-slip flooring, and the protection devices to prevent falls. It's the result in these pictures. We also notice the need to create a space for professional training. So this room was assigned to this, and we equipped it so that the assistance team could use for the support training. In these pictures, you can see meetings accomplished to discuss specific cases. For the adequate data storage and for management too, an online access software was created, which access was only allowed through personal login and password, and data are stored in the cloud. This is the software interface, and you can see the space for login with password and patient information. And after organizing the registry of patients, clinical information, we proceed to the implementation process of the strategies. For telecardiology, we organize a space to place the equipment inside the doctor's office and implement a routine where electrocardiograms are performed in all the elderly who live in a nursing home every 6 months. If a change is identified, these exams are repeated in 3 months or whenever the care team needs it. For this to be possible, we conduct training both for the use of the software and conducting exams. These pictures shows the moment when the nursing is registering an exam. This is a moment that cardiologist receives the exam for interpretation, where on the left side it's possible to see how the cardiologist received through the cell phone and the right through the web. To implement the telecardiology strategy, we equipped them with an iPhone 5S to capture the images, and large lesions were recorded with the iPhone camera and small lesions with a dermatoscope attached to the cell phone. The images were recorded to an app called Finder, which allowed the insertion of basic clinical data and the identification of the local where the image was captured according to these images. The recorded images are uploaded to a cloud platform called Finder Hub. This is an example of the process, and this is the Finder Hub interface. Each line in the left image represents one patient, and each patient has a gallery of his own images. The gallery of each patient is organized by date of registration, and when clicking on an image, it's possible to see it enlarged. In this context, all the elderly who accept to participate in the strategy have their main points of pressure recorded. All identified lesions are monitored, and there are the images recorded weekly, where, if is necessary, we can refer them to the dermatologist or infectologist for a second opinion. The platform also allows to compare images to see the evolution of the treatment, as in this image. And here you can see another example. About the preliminary results, there are currently 98 elderly people living in the nursing home. The average age is 81 years, and the prevalent risk factor is hypertension, present in 50% of the population. In the period from September 2014 to March 2018, 607 exams were performed. Of these, one myocardial infarction and 30 cases of atrial fibrillation were identified. When we started the teledermatology strategy, we had a total of 18 patients with skin lesions. We evaluated through the Braden scale the risk for development of lesions, and 44% had low risk and only 5% very high risk. And the type of lesion present in the most part of the cases were pressure ulcers, representing 83% of the cases. About the most affected area for skin lesions, in this image it's evident that the most affected sites were the heels, representing 39% of the cases, and the coccygeal region with 22% of the cases. Evaluating the healing process with push scale, we observed the time for healing of the lesions of 12 patients. 6 patients died before the end of the treatment. 27% of 12 patients had complete epithelialization the 2-month period, 16% in 3 months, and 22% need more than 3 months for complete epithelialization. Currently, we have 5,410 images recorded, from which 5 dermatological consulting have been requested. Finally, the implementation of strategies of teleassistance offer more autonomy and security to the team, optimizing the team in the resolution of the cases, and it suggested that in the next step a clinical trial can be conducted comparing the implementation of the teledermatology strategy to the face-to-face method. This is my team. Thank you very much. I'm available for questions.
Oh, thank you very much, Professor Patricia. Well, this is really also very important for us because as the world is getting old, the assistance to elderly people is part of our major challenge for the next several years. So, starting this kind of activity, providing teledermatology assistance and also tele-ECG uh, for the elderly people living in this region in South Brazil is really very important. So congratulations for the very interesting presentation and work, of course. So I thank you very much. I think we had a very nice session this morning. So before closing the session, I would like to say that the two presentations are recorded, and the link to this recorded session will be provided to the ISfTeH members soon, so people will be able to watch it again or review the content of the presentations. So please stand by and will be informed about the access link to this session. I also would like to thank the participation of the two coordinators of the telenursing working group, Dr. Konstantinos Antipas, that started as the chair of the telenursing working group in this year, and also Dr. Claudia Bartz, also the participation of the executive secretary of the ISfTH, Mr. Frank Livings, and several other colleagues, because I see that we have around 30 or 35 people attending this session right now from different countries. So thank you all very much for your participation, and I look forward very much to seeing you again in the near future. I think the next session, the next webinar, will be held on early June, and probably will be organized by the Telecardiology Working Group. That is a new working group of our society. Well, at this moment, I should thank again the speakers, Dr. Clarissa and Professor Patricia, and to say goodbye to all of you and hope to see you again during this year, during the next webinars. So goodbye, good luck, thank you so much.
Thank you very much, Dr. Adolfo. Bye-bye.
Thank you.
Bye
Bye bye.
bye. Goodbye. Thank you very much.